7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show. Friday, September 21st. We're ripping right through September here and bringing you the latest and greatest in health. As you know, you can always find the shows on allcountyhealthcare.com or their Facebook page. There is a great area there where there's an archive of the shows. And if you ever need to go back and, see a little bit about one of the doctors or get their information, you can just go there as well. And I'm actually sharing it to my Facebook page because that's how you get a lot of viewers on the show, and we like to do that. I'm going to welcome in a minute here Dr. Zakiya Moyenda. He's a family medicine physician who has an office new to the area, but he's practiced medicine in South Florida for a little while now, and he's actually moving into his practice is new to the Boca Raton area. He's moving into an established office. So without further ado, I want to welcome Dr. Moyenda. How are you doing this evening?
Doing well. Thank you, David.
Thank you.
Nice to be here.
And thank you for joining us, like I always say, on this adventure of health, because we learn so much from having doctors from all different specialties on the program. I want to talk a little bit about the business of healthcare and how it relates to patient care. It's not a question we get to ask very often on this show, so tell us a little bit how they connect.
Well, yes, thanks for asking the question. Excuse me. Business of healthcare, as you know, is very pertinent to how it's delivered, because who's paying the bills, right?
Definitely.
The turn of the century, if you read a book called The Social Transformation of American Medicine by Paul Starr, he talks about doctors used to go and do home visits and get apple pie.
Oh, yeah.
Right? That's how healthcare used to be practiced. But as the healthcare industry evolved over the 80s, in the 80s, you'd have the health insurance companies now tying the financing of healthcare with the delivery of healthcare. So now doctors are being told how many patients to see, how fast to see them, what you can order, what you cannot order. And then there's incentives, financial incentives, and kickbacks, if you will, that are attached to delivering healthcare. So with each patient encounter, a lot of times doctors are forced to think not so much clinically as to what's best for the patient, but what will it cost? And that becomes the biggest challenge. Obviously, we're always going to do what's best for the patient to get them feeling better, but the business side of healthcare tied to insurances, third-party reimbursement, and all the changes in that regard is so intertwined that you can't talk about good delivery of healthcare without talking about the business of healthcare.
Yeah, it's almost like you have a whole different gamut of jobs to do there,
right?
To keep the business flowing in the office, because you're going to have to hit a certain amount of patients, like you said,
right?
And that can be tough. And like you said, doctors take an oath to provide the best care they can.
Yes, absolutely.
And to worry about real estate, lab coats, business cards, and on top of that, like insurance, which is always changing, right?
Right.
You've experienced this in just your time as a physician.
Yes, absolutely.
So that can be tough.
Right.
I always like to ask this question early on. How did you get into medicine?
Okay, so I worked in the business side of healthcare for about 8 years. I have an MBA in health administration in the late 90s. Always wanted to do medicine, sort of shied away from it for many different reasons, lots of different excuses. But being in the business side of healthcare only further sparked my interest to be near the action. I'm a people person. I love people. I like to impact their lives on a more personal level. being an administrator did not necessarily offer that opportunity. A lot of meetings, a lot of planning, but not necessarily instituting the things of that nature. So after 8 years of working, I did a lot of prerequisites, ended up going to medical school and finished in 2010.
Congratulations.
Yes, well, thank you.
So yeah, you did the MBA first.
Right.
That's a different path. But you were saying before, and before we actually got in here,
Yes.
when you were in the hospital or healthcare settings, that when you were on the business side of things,
Right.
you always felt like, oh, I could do so much more as a provider. You know,
Right.
If I just maybe I should go back because maybe that's my calling.
Yes.
And
Yeah.
it really is, because I can tell just meeting you today. You know how your demeanor, and you're very outgoing and very helpful. We went over the questions beforehand. I really like that.
Yes.
In a doctor, because you want your doctor to listen to you, to be receptive.
Right.
Those are, I mean, I'm starting to go to doctors now at my age and, you know, my size. And, yeah, it's the two things I look for.
That is the biggest challenge, you know, just to bring up that point again, how many patients we have to see in this day and environment. That becomes the most intriguing as well as challenging thing for most, not just doctors, nurses also. How do we give the high quality, compassionate care in that setting, explaining all the complex diseases that they may have, and the instructions for their medications, and breaking all this down and synthesizing it in such a way that they'll be not only understand it, but feel inclined to follow the treatment plan without being so intimidated, and do that within like 5 minutes.
Limited resources and restrictions.
Right.
I mean, that can be tough. Right. Well, I'm telling you what I'm going to give. I'm going to give out your info a few times.
Absolutely.
This afternoon into evening, the drive.
Yes.
It's Dr. Zakiya Moyenda. He's a MD and MBA. He's in the office of James McCauley, MD, PA, which you'll recognize, a longtime physician here in Boca Raton, 951 Northwest 13th Street, Suite 3D, right here in Boca Raton, 561-392-0310, and we'll give out that info a few more times. So, Dr. McCauley,
Yes.
how did that come about? I mean, you were telling me a little bit about him. He sounds like an amazing gentleman, but now you're working in his practice, and
Yes.
that's great news.
Yeah, amazing, man. We don't get a chance to really work directly, but I've met with him, and he's been a beacon, like you said, in this environment, in this community for over 30 years, probably even close to 40 years. He has a long, long patient following. I've met with some and treated some of his patients that said they've been with him for over 35 years. And so that speaks volumes. If a patient, you know, the families have been with you for that long, that tells you what kind of clinician you are. So I answered a part-time advertisement for work in the area, and I met with the office manager, Bonnie, which, by the way, the office staff there is amazing. Carla's there as our front desk receptionist. We have Michelle and Karen as our nurses, and Bonnie is our office manager. And if you want a good home environment, you feel welcome, you feel like you're going to be heard, you're going to be seen on time, you're going to have your medications instructed to you, reviewed on every visit. This is the office to come to, because we pride ourselves on not being confined to a lot of these external parameters. We're going to give the patients what they need, sort of in spite of what's in front of us in terms of third-party payers.
And Dr. Moyenda, I know just from the address 951 Northwest 13th Street, Suite 3D here in Boca Raton, that's right near Boca Regional Hospital.
Yes, it is. It's actually about 2 blocks, and just recently got on staff there, so I'll be accepting patients. We're actually accepting new patients in our office, but also be following the patients in the hospital.
Congratulations for being on staff at Boca Regional Hospital.
Thank you.
That's
it's an
great.
honor.
And you're also on staff at another local hospital.
Yes, I'm actually on staff working at JFK Medical Center now as a hospitalist. I work up there as an independent contractor, seeing critically ill patients in the hospital exclusively. And actually, that's what I've been doing for the last 3-4 years.
Is that what we call a hospitalist?
It's actually a hospitalist.
We finally get the hospitalist definition. We're so lucky to have you here tonight, because, you know, hospitalists are very busy. They're hard to get on the show.
Yes.
But here we have a veteran hospitalist who's been in the mix for a few years. And big shout out to JFK Medical Center. My mother-in-law Susan works there. I think you know the floor, so that's fantastic.
Yeah, too central.
It's a great hospital as well. I've been have had some family members who have had some treatments there, and all's been well. So we've had some doctors from there on the program. And
nice.
Boca Raton Regional Hospital, we've had over the last 3 years so many doctors on. It's a great neuroscience hospital, great orthopedics as well.
Yes.
And just a great hospital altogether. So we're so lucky to have physicians like you on the program. And
Thank you.
family medicine, I know you deal a lot with pretty much everything. I mean, you see everything come through your office.
Right.
But one of the things I wanted to ask you about, since we have you here in the hot seat, is how can a primary care physician help with preventative medicine, because we hear a lot about that.
Right.
What we should be taking measures so we don't have to maybe be put on pharmaceuticals or whatnot, or so we can live a better quality of life. But coming from a family medicine physician, we'd love to hear.
Right. So we are as historically known as the gatekeeper of the healthcare system, the primary care physician. So our job mainly is to synthesize and coordinate all of the care that a patient may have, particularly if they have a lot of chronic conditions such as diabetes, hypertension, ischemic heart disease, COPD. All these chronic conditions require the help of not just their specialists. The specialists are there to manage acute flare-ups or ongoing long management for really complicated cases. But for the most part, they're on a lot of medications. So to answer your question, what can a primary care physician do? Well, number one, we can communicate clearly. We can make sure there's appointment times available and convenient for them, not keep them waiting. Go over their medications on each and every visit and explain to them why they're taking it. Because they'll be getting medications. Say if a person's on 10 medications, they may get 3 of them from their cardiologist, 2 from their renal doctor, and maybe the others from us. And if they go to the hospital, they may get put on another medication and others get discontinued. So
you got to be like a detective to figure out each and every case.
We absolutely have to be a detective. We have to advocate for our patient. It may mean it may require additional phone calls to the hospital or other specialists to say, hey, did you start this medication? But all these things, they take a little bit of effort, but they go a long way, because we found that the extent to which patients do not comply with their medication, especially for chronic medical conditions, they find themselves being admitted to the emergency room. And then the cost goes up. And another thing we want to do is keep patients out of the hospital. And by reviewing their medications is a big thing. Controlling their blood pressures is an easy thing to do. But we have to get them to take their medication. We have to get them to refill it. So all these are things that we can do to help.
Sounds like the most important link in the chain of healthcare there, if you ask me. Yeah. I do want to give a shout out. One of the doctors we've had on the program, see, we do get Facebook messages. Dr. Clone Martinez, she's an orthopedic surgeon out at West Boca Medical Center. She says to Dr. Moyenda, hello, can't wait to meet Dr. Moyenda. So I hope you guys get to connect.
Yes, looking forward to it. I believe Peter and I were talking about her this morning.
Yeah, so she's watching the show.
Awesome.
And thank you, doctor, for taking the time to tune in. That's fantastic. We have a cardiologist who regularly tunes in to the show, so that's great news. Your peers in the medical community are right here.
Yes.
I want to piggyback on a thing really quick that you said. So you mentioned diabetes, COPD. These are ailments that are connected to systems of the body, and this can cause all kinds of problems once you develop one of these ailments. Like we found out recently how COPD can lead to advanced heart failure.
Absolutely, yes.
Yeah, general public would never thought about
right-sided
that.
heart failure, yes.
Unbelievable.
Yes.
So this is all intertwined, the whole system.
Right.
And that's family medicines. They're the experts in the whole
Absolutely.
system.
The biggest things we deal with for the most part are uncontrolled or essential hypertension, primary hypertension that's just uncontrolled, diabetes, hyperlipidemia or dyslipidemia, high cholesterol, and COPD as well. These are conditions as a result of that lifestyle adjustments can also help. That's another means by which we can help prevent the worsening of chronic diseases as well as prevent them.
And we're going to get right back into that. We're going to take a quick break, and on the other side, we're going to talk about some ways maybe people can stay out of the doctor's office, eating and nutrition, etc., on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And we're back, How to Stay Healthy show with Dr. Moyenda. He is right here in Boca Raton, 951 Northwest 13th Street, Suite 3D, right next to Boca Raton Regional Hospital here in Boca Raton. And we were just talking about, hypertension, diabetes, and how these ailments can kind of attack a whole bunch of different systems in the body, and
Yes.
and just over time, if they're not dealt with, I mean, it's not good news. So
Right.
you were before I cut you off there for the commercial, you were going into a little bit about eating and nutrition. Is, in your opinion, is that the connection to staying healthy?
Well, I think for sure it's a huge part in it. It's multifactorial for sure. Some people have conditions where medications, they absolutely have to be on medication. Whereas my practicing pattern of medicine is where I try to be very judicious in how I prescribe medicines. Unless they absolutely have to be on the medication, I don't put them on the medication. If we have a chance to pull them off, we take them off the medication. But some people have really high uncontrolled blood pressure, for instance, or really severely elevated blood glucose levels that can lead to horrible consequences if uncontrolled. So we have to, remaining uncontrolled, we have to give medications. But certainly, if you have high blood pressure, any form of ischemic or heart disease or diabetes, any, metabolic disease, the intake of food is going to impact upon that. So most of the diseases we know is caused by chronic inflammation. And so eating foods that are rich in, in vegetables, fruits and vegetables, is very important to stay hydrated, to stay active in terms of physical activity. We know all of these things are important. But it's actually getting the inspiration and the knowledge to do it with our schedules.
We hear that all the time, but we never hear the reasons why it's important, and you just told us the reasons why. So we can add maybe the Mediterranean diet to that as well. Are you a big fan of that?
Absolutely. The Mediterranean diet, the DASH diet, dietary approaches to stopping hypertension for people who have on the borderline of, it's an acronym, DASH. You can look it up. And we actually recommend this to a lot of our patients who are younger, active, but for whatever reason, maybe genetic, they have pre-hypertension. Maybe they're running at 140 systolic or 150s, but they live a healthy lifestyle. They're not smoking, they're not drinking, they just have elevated blood pressure. We recommend the Mediterranean diet, DASH diet, and exercise for those patients.
Well, Rachel heard another one of our providers who's been on the show. She asked about, what about paleo? Have you had that question from your patients? The old paleo diet, no gluten, no grain, no dairy, no refined sugar. Did I get that right?
I haven't heard the name itself, but I've heard no gluten. People have success with that, especially a lot of patients who come in with sort of ill-defined, atypical abdominal symptoms, bloating, pain, different symptoms with their bowel patterns. Sometimes we put them on a gluten-free diet for 10 days, 2 weeks, and find good results.
And that's also so that's no granulated sugar. So that it
Right.
uses a lot of that diet uses, I know, a lot of coconut sugar and coconut oils because my wife's actually a pastry chef and we do a lot of paleo stuff. And I actually I went on a gluten-free diet for 6 weeks once and to try out some new items and lost 15 pounds without even working out.
Oh, nice.
But I need to do that again.
Maybe I need to do it too.
Oh, you're looking good. I mean, the one thing about doctors in that chair, they're in great shape because you don't probably eat a high salt intake, which is the fuel for probably hypertension, I would imagine.
Right. Yes.
You're eating a lot of fish and olive oil salads.
Yeah, I eat pretty good, but I think the biggest thing for a lot of us is our schedules. You know, a lot of us, we do have bad eating habits, but our schedules and our inability to burn off calories is the biggest thing. And that means getting an exercise regimen.
Doctors figure it out, though. And I found out from interviewing doctors, I'm gonna say something here. Through your residency and training, you are put through so much that you learn how to, figure things out, solve problems.
Right.
What time of the day do I have to work out? Should I be eating late at night?
Right.
I mean, you eliminate those things.
Right.
Because you've been through the education and training.
Right, but that's an abnormal lifestyle.
It's tough. It's not for everyone.
No.
But you love it. I can tell.
Absolutely.
I can tell you're passionate about it.
Like I tell everyone, if you like people, you'll like medicine. You'll like pretty much most vocations you'll do. But especially in medicine, whether you're a nurse, whether you're anywhere dealing with a patient, taking care of patients, you have to have a genuine interest in people. Then you'll have a good time, even though it's hard work, a lot of challenges, but overall it's beneficial.
Well, that's one thing I always see too is, most doctors take care of themselves as well. I mean, that's a whole nother ball game, but definitely something that the general public, I mean, we have to take time for ourselves as well.
Yes.
And not be eating at the wrong times.
Right.
I've been guilty of that many times.
Yeah, I think we all are, to be honest.
Yeah. Some more
it's all
than
about
others.
balance.
Yeah, definitely. And emotional eating too, right?
Right.
And portion size in the U.S.
Well, as you say, emotional eating, that leads me to get back into the clinical discussion. We deal with a lot of depression also in our office. And a lot of times people are depressed and they fall through the cracks because of the stigma of going to a psychiatrist or a psychologist. We find that in our capacity as primary care physicians, we end up seeing a lot of patients with depression that are underdiagnosed a lot. And so they end up having a lot of irregular or abnormal eating habits. So there we have two things we're dealing with. It could potentially be obesity, or three things: obesity or metabolic syndrome and all the things that go along with that, as well as a depressive state. And so they'll count on us if we start a medication for depression to follow up and keep up with that.
Yeah, and it's that combination, and
yes,
it seems like unfortunately depression has been on the rise in this country lately.
Very much so.
I mean, we're hearing a lot of stories from all different walks of life,
right,
as well. So definitely take the time to find a great primary care physician. We have one right here in the seat across from me, Dr. Moyenda, 951 Northwest 13th Street, Suite 3D, right here in Boca Raton, 561-392-0310. You'll recognize that address. It's also the office of Dr. James McCauley, and you said he's been practicing this area 3 decades.
Yes.
I knew the
At
name.
least
I've never
3
had the
decades.
chance to meet him.
Yes.
He said he Air Force veteran too?
Yes, we shared stories because I told him my father was in the Air Force.
Oh, really?
And he looks like he used to fly airplanes, so he actually does physicals. Used to do physicals for a lot of the airline pilots that come through and need physical exams. So,
well, Dr. McCauley, thanks for your service, and to your dad as well.
Yeah, thank you.
Thank you, and thank you for being here. We have a few more minutes. I would like to tell a quick Air Corps story as we're right here in Boca Raton. So my grandfather, the reason I'm sitting right here today is he trained at what is now FAU, was the U.S. Air Corps field before he went to World War II. He trained in radar school and then was put on a B-29 bomber crew. And I believe was over Italy, the theater in Italy and Germany. And he's actually shot down in World War II. Took some bullets through the ankle and the turret gun. Unfortunately, the next day, while he's in the hospital, his whole plane went down. They lost 14 soldiers. He wasn't on the plane, obviously, the reason I'm here. But he always remembered Boca Raton and going up and down Military Trail and having some time to get off from the beach in Delray Beach.
Wow.
He moved his family down here from Chicago. Here we are today.
Wow, what a story. Is
So-
that the same airfield that's there now?
Yeah, if you notice behind the stadium, there's
Yeah.
a whole bunch of concrete, long roadways. They're actually old runways. There was over 800 barracks there. I
Yeah.
just did some research on it for a story. It's amazing.
Yeah, I pass there every day.
And that's why the airport's there, the executive airport. That's
Yeah.
another one of their old runways.
Okay.
It was the B-29 bomber, Flying Fortress, did their training there. The radar school. I think there were over 40,000 that came through there during World War II.
Okay.
And it was, remember, the Air Force wasn't established yet, I think, until 1954. It was the U.S. Army Air Corps was the name of the program.
Wow.
It's part of the Army.
Yeah.
So,
Interesting.
yeah, I just had to throw that in there.
Oh,
We have a
nice.
few more minutes, though, so
Okay.
I'm going to ask you a couple more questions. What, outside of medicine, I always like to ask this question, doctors, what are your hobbies and passions in life?
Yeah.
It doesn't sound like you have a lot of extra time, but...
Well, I make time, I make time. I like to read, obviously. I like to write. I like to write poetry. Actually published a poetry book 2 years ago, actually in March of 2016.
Oh, nice.
It's called Eternal Soul. So I like to do that. I like to exercise. I like to bike. I tore up my knee, though, back in March, so it's been on hold for a little bit.
Did you have to see a doctor?
Yeah, I had to see a doctor.
Did you have to have surgery?
No, I'm trying to fight
lovely.
it. I'm trying to fight it.
Okay.
I don't have time to have surgery, to be honest. So,
Yeah.
but other than that, that's pretty much it. I really don't have too much time for extras, but I do. I like to cook as well.
Oh, that's nice. I'm a writer as well, so
Oh, do
I knew
you?
we had something in
that's
common.
right,
So
you're journalist.
first thing we did is connect. I did for a few years Sunset and Forum Publishing Group.
Yeah,
And now I
nice.
write for the Delray and Boca newspaper there monthly. But I want to thank you again for telling us so much about family medicine care.
My pleasure.
And
Thank
this
you.
was so informative. It really was. And we'd love to have you back on the show. We got about another minute, so I'm going to use it to tell people again where you're
Okay,
located.
Absolutely. Thank you.
But you're always welcome on the show.
Yes, I love to come back.
Thank you. And it's Dr. Zakiya Moyenda. Dr. Moyenda. He's MD and an MBA, so he's got the business background as well. 951 Northwest 13th Street, Suite 3D, Boca Raton. Right near Boca Regional Hospital. Dr. Moyenda is also on staff at JFK Medical Center, and his phone number is 561-392-0310. If you need a primary care physician, and we all do, Dr. Moyenda is your doctor. Until next time, thanks again, Dr. Moyenda.
Thank you again. It's my honor and pleasure. Thank you.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its host, guests,